Inc. Our talk is about the tips and technique for nasal swab, pan-bio COVID-19 antigen rapid test device. It is not a nasopharyngeal swab, as just Sir Alan said, but a nasal swab, so it is much more comfortable now. So first, we will prepare the following. You will need 2 pairs of gloves, 1 inner pair for your protection, and another outer pair which you will change after each patient. A disposable isolation gown, face shield. You can use a surgical face mask, but better if you can use an N95 mask. How to do a proper don? First, it is important to wash your hands well with soap or alcohol. Second, you wear your gown. Then it is followed by wearing your mask, or is your eyewear or your gloves. So how do you put on or take off your mask properly? Cup the N95 mask in your hand, put it over your nose and mouth, then put on the straps. One should be below the ear and the other above. Don't forget to press the sides of the nose to make a tight fit. It is important that you have a tight seal. To check, inhale, and see if the mask moves towards you. If it does, then it is a tight seal. Then, you try to exhale around the nose, then adjust the area. If it leaks on the areas under that, then you just have to adjust the straps. If you cannot achieve a proper seal, then you have to get a different size or model. How to properly remove your PPE? Again, it is important that you start by washing your hands. If not, you can use an alcohol. Do not forget that this is the very first step.
The very first step.
So, remove your gown and gloves. But since you touch your gown and gloves, which are supposedly dirty or contaminated, you have to disinfect your hands again with alcohol. Then remove your eye protection or your face shield and disinfect your hands. Then lastly, remove your mask and end with a disinfection of your hands. So as you can see, it is a tedious and repetitive process, but it is important. Our tendency when removing the mask is to touch the mask itself. But we have to remember that it is contaminated. So instead of touching the mask, we will just touch the straps. The tendency is we start with the top strap, but actually what we have to do is start from the bottom strap and end with the top strap. And don't forget to wash your hands. Now, we will discuss how to do the nasal swab. The nice thing about the new nasal pan-bio rapid test, it is much more comfortable for the patient and so much easier for you to do as a swabber. Patients who have tried the nasal swab do not like to have the nasopharyngeal swab anymore because it is much less pain and more comfortable. Tip number 1. Explain to your patient the procedure and assure her that he or she will feel some discomfort, but it will be tolerable.
It's vulnerable.
So let us go into a little basic anatomy. This is the tip of your nose, as you can see the arrow. This is the nares or the nostril. And if you look at the end of the arrow on the red dot, that is your mid-turbinate. And that is the area where you want to reach but not beyond. The line that you should draw should be at the level of the middle ear. This is the line that you will follow while inserting the swab. So, step 1, you tilt the head of the patient 70 degrees backwards so that it is easier for you to insert the swab along the plane of the nasal floor. It is helpful to rest the head against the wall. Tip number 3, hold the swab just similar to holding a pencil. Step number 2, insert the swab into the nostril parallel to the nasal floor until you reach the resistance. This should be your turbinates. Insert it around 1 centimeter into the nostril, depending on how deep the nose is. In inches, this is around half an inch. So you do not want to go beyond 3/4 inch. So in centimeter, it is 1 to 1.5 centimeter. Remember, be gentle. So step number 3, slowly rotate the swab, gently rubbing it along the inside of the nasal passages 5 times. Then you do the same to the other one. Then afterwards, you gently remove the swab. Always be gentle. To summarize, these are the steps. 1, tilt the patient's head backward 70 degrees. Number 2, insert the swab along the nasal floor until you reach a resistance. Step number 3, rotate the swab 5 times in a circular manner, wiping the inner walls of the nostril. Then repeat on the other side. Then slowly remove the swab. Place the swab into the sterile viral tube or the extraction tube. Snap the applicator, close tightly, and it is now ready to be placed on the test.